All right. It is August. It is August. Dr. Michael Goldberg of Practice Perfect Systems, myself, Eric Vickery, All-Star Dental Academy, our Fireside chat every month. And today we're going to talk about trust, building trust. And so, man, as soon as I hear things from patients, or even it could be even building trust with team members. We can talk about both categories here, but patients, I need to go home and think about it. Those are the signs that get me to think, I wonder if they're not trusting how we're doing this, or there's really low referrals, really, really, really low referrals. That typically also makes me nervous on the trust factor. What are areas you see that are signs that we're not building trust with patients? Obviously low case acceptance as well, which is what I was referring to at first, but.
So low case acceptance are two things.
Yep.
And they work in tandem. One is value and the other is trust. So if someone says, I need to think about it, you probably haven't either built up enough value or enough trust, or both.
It could be, I was gonna say a combination of either of the two. Yes.
Right. But I would maintain that trust is probably more important.
Yeah, it's so the 95-5 rule, things that we teach on focusing on condition and the urgency of things, that's kind of easy to do if you're on purpose about it. What I think is under the current, it's beneath the surface, people don't really see it, is this trust. Nobody comes out and says, you know what, Dr. Goldberg, I just don't know that I trust you. I think I'm going to hold off. They don't say that, right?
Right.
They could even say, I can't afford it.
I'm going to think about it.
Yeah, I can't afford it right now. They could throw anything out. Or even a cancellation. Somebody who cancels on an answer machine doesn't say anything about I need to reschedule it. They say, I need to cancel my appointment.
Right.
Shows up all sorts of ways, except for when the word trust that doesn't happen. You might hear I need to get a second opinion. That you might hear.
Right. And that's interesting because oftentimes if I'm looking at someone's face while I'm presenting treatment and I see doubt, I will recommend a second opinion. A second opinion, just the action of recommending a second opinion is trust building, because it gives the person confidence that I have confidence in what I've proposed. I'm willing to put that to scrutiny.
So how do you say it so they come back? Because I think the fear is, I say, go get a second opinion. They're going to go to that person and not stay in our office per se.
So oftentimes, just by saying, you're free to get a second opinion, is, I think, liberating enough that they won't.
They don't actually go get it.
No, I would say, I'd say you're right in general. If I have somebody that goes for a second opinion, they don't come back.
Yeah, without you announcing it first. Yeah, true. Yeah.
And then I control the second opinion. You can't get a second opinion from anybody. I mean, I'm not talking about a small case. I'm talking about, a major rehab.
Yeah.
You have to go to somebody who does that and who isn't going to, try to undermine what you're doing.
Yeah. I love when there was two doctors in the office. I just had this talk with a client before us, actually in Canada, and she was saying, it was a son and a mother. The mother didn't speak English, so the son was translating, and it was a vertical fracture situation. That was in pain and they wanted a root canal. And she's going, you know, this is a problem. And she could read the doubt on their faces, you know. And she actually even suggested, well, you could go to an oral surgeon for a second opinion, or an endodontist for a second opinion. Either way, it's going to end up, you know, where you have to have it extracted. And they're like, that's going to take multiple days. She's in pain. We don't really want to do that. So she called in senior doctor to come in. She didn't say anything, just kind of stepped aside and said, you know, would love you to take a look at this tooth, Dr. M. Let us know what you think. He said the same exact thing, recommend the same exact thing, because he got the sense that they weren't buying in either. And, you know, as an older patient, extraction, you'd think it'd be more straightforward with just believing that. I don't know where the doubt was being created, but, you know, we're dealing with the doubt in that regard versus how do we make sure we prevent the doubt? In other words, build trust beforehand. So we talked about it a bit on the conversation, and she ended up doing the treatment extraction, but we were working on word pictures. You know, we were describing the situation in a way that the patients could really understand it. So we used, you know, the wood post, the cement, the fracture on the wood post. We did the knuckles, you know, together teeth. We did all the things. We talked about it. And so trying to help people simplify the language so they get it. You know, there's a fracture, but I can't see it, right? So building trust has got to be something that's a part of the entire process. In other words, the person who answers the phone is actually improving trust for the person who sees the patient. The assistant who sees the patient on time or a minute early or whatever, all of those things are a culmination of trust building. There's this factoring that's going on almost on a subconscious level with the patient. Every single interaction they have with you is determining how much they trust you.
So you said something in the example that the person didn't speak English.
Yeah. Yeah.
That is a real impediment to trust building.
Yeah.
You don't speak the same language.
Yeah.
It's
true.
hard.
Very true. Yeah. So we use emotional intelligence. You were just referring to that. You're reading doubt. That's your ability to read the room, right? That's not self-awareness, that's reading other people. And so your EQ has got to be on point with this. You've got to have the ability to read others and have some the art of uh, discernment. The art of discernment.
And
Yeah.
it's looking at people's eyes, facial
Mm-hmm.
expression,
Yeah.
body language.
Yeah. Eye contact.
All of those things factor into it.
As a dentist, what were some of the things that you saw that caused you to realize, okay, they're doubting me right now? What were some things that you experienced as a dentist in that role?
So that's a good question, and I don't really have a great answer for that. And it's probably because I spent a lot of time. Well, go back.
Mm-hmm.
Trust starts not on the first phone call. It starts in the referral.
Yeah, before that, whatever the marketing source is. Yeah. Yeah.
So my referral sources were mostly
Yeah.
either other patients or more commonly physicians.
The physicians. Yeah. Yeah.
So if I had a physician refer a patient, they already came in with a built-in trust factor.
Mm-hmm.
So it was in my cases, it was actually fairly simple. I didn't do any traditional marketing. And then when I opened my satellite office here in New Jersey, I used this system that I teach. It's called the seminar system.
Mm-hmm.
I invite people to seminars on different topics. When my close rate at those seminars was 80%. And that is a trust building process. They see me teaching,
Oh yeah.
they
Credibility. Yeah.
hear me answering questions, and they get to know me a little bit,
Yeah.
raises the trust factor up. So even though I didn't get as many physician referrals there, the seminar system that I used for marketing that practice was very effective in raising the trust level. And then there's, I wrote books. So, I wrote a book called What the Tooth Fairy Didn't Tell You. Um, just by being an author raised my authority.
Credibility. Yeah. It's that credibility
And
factor that you're talking about. Yeah.
so
So
all of these things
yeah,
really.
it's all combined. It's all a combination, culmination of it. I would say body language is a huge thing to be paying attention to. So one of our systems we adhere to is just the ability to be in sync with the patient, be knee to knee, eye to eye with them, not hovering over them, not your back to them. You don't have your loops on and all this kind of stuff. All of that. You've got to be in good rapport building body language, right? There's that rapport word we love to use in the great call process, right? You're building rapport. And if they're not making eye contact with you, or their arms are folded, or they're, doing these sorts of things, and you can't get in good rapport and in good sync with them, it's probably telling you something. There's something speaking to the gut. So that's typically what I would say to watch out for.
So it's interesting. I used to love it. I sort of played a game with it. The only time I really had issues like that were emergencies.
Mm,
People who've never seen me before.
yeah.
They come in, oftentimes in pain.
Mm-hmm.
So not the greatest rapport building situation.
Opportunity. Yeah.
Yeah. And I was like, it was a game. All right. How quickly can I get rapport with this person? And a lot of it is, trying to find commonalities, not talking about dentistry. That's a mistake that I think most dentists make. When you meet a person for the first time, don't talk about what you're doing.
Mm-hmm.
Right? Talk about them.
Be interested, not interesting. Yep.
Right? Talk, and don't talk about you.
Mm-mm.
Talk about them. Talk
Mm-hmm.
about what they think is important about them.
Mm-hmm.
Try to find commonality.
Mm.
Right? Um, Linking and syncing.
Mm-hmm.
Right? Try to get to speak the same cadence
Yep.
that they speak in, because when that happens, they will listen to you better.
Yeah. Yeah.
All of those things.
Yeah. Using a similar language, something in common, like a sports team or family, or somebody who knows somebody. It's just a commonality.
So and we started that beforehand. So I think I've probably mentioned before. We Googled and Facebook every single one of our new patients. I want to know as much about a new patient
It's good.
as I possibly can, so I can fast track
Mm-hmm.
that rapport and then build trust upon that.
All right. Let's see if I can do this. I'm going to try this. This is the first time here on a recording. We're going to do a whiteboard. Let's see if I can do it. Let me know if you can see this once I pull this up. New whiteboard. All right. Let's see if this works. Can you see the whiteboard there?
I see a whiteboard.
All right. Let's see if this works. All right. Come on. Here we go. Draw. We're just going to go like this. This is from Dr. Ted Morgan, one of our co-presenters. Okay. And he talks about the trust curve.
Yep.
Right. And all he talks about is, trust on this vertical axis right here. Right. And right here is, well, I'll write time, but it's relationship. Okay. And what you're talking about is the amount of time you spent behind the scenes building relationship and doing research, right? Now, you mentioned when and here's a trust curve. Here's just an example, okay? And if you push too fast, right, they're not going to accept. You try to present a treatment that's this expensive, it takes this much trust to do, and they trust you this much, you're not going to get it. Danger zone, right? This is what he calls the safety zone over here, okay? But you mentioned somebody who comes into you who's referred by you, right? And they know you, and they know somebody who knows you. Their trust curve might look more like this.
That's right.
They didn't even come in at 0 time, zero trust. They came in at 0 time, higher level of trust. You just can't blow it if they come in here and you have bad rapport building skills and it goes like this. That's obviously what we don't want. So, how you answer the phone, how you greet them, how you take care of them. Do you seat them early? What's your physical plant like? Are you interested, not interesting? What's your rapport building skills like? How are your verbal skills? All of that's playing a role in building great trust. So sometimes you have the really long to trust you patient that comes in. You ever notice sometimes you have this long standing patient, all of a sudden they do that large case. They've been coming to you for 4 or 5 years, and all of a sudden, boom, it just hits right here. That happens too. And that could be life circumstances changing for them as well. So again, this could be relationship down here as well. That makes sense?
It does.
Yeah.
I I would say that someone comes in and in 4 years they need a large case,
Mm-hmm.
you probably didn't do a good enough first.
Yeah. You're saying how it ought to be, right? Can be like this too. In
So
fact, that's often what we're looking for. The question is, did they need to take care of the kids first before they took care of themselves? The case didn't happen, 100%, but there was some sort of life condition that got in the way. Not that
so
they
we
didn't trust you.
right. And
Yep.
and there are times when people aren't ready for the
Mm-hmm.
big case,
Yep.
and we phase treatment
Mm-hmm.
sometimes.
Yep.
I knew where they were going to go.
Yep.
They I told them where they were going to go,
Yeah.
but it was hard for them to accept that right now.
Yep.
Uh, Certainly didn't want to do anything that was going to, you know, cause any damage
Yep.
during it.
Yep.
Yeah, so sometimes we did phase therapy so that, maybe it took a couple of years until we finally.
Mm-hmm. I think that is a plateau that practices have to understand the breakthrough. I think the average practice lives in this world, single tooth, quadrant type dentistry, maybe 2 teeth at a time. Now we see it in our practice numbers. We see the clients who are already doing $1 million a quarter, here instead of $1 million a year. And the difference in that is large cases, large amounts of dentistry done quicker because it's so much more efficient, both for the patient's health. This could be a health trend, right? You could also look at this and say, okay, this is how healthy you're getting is in correlation to the trust factor. So that's a difference maker with not only getting over your own approval addiction, fear of rejection, all of those things, using the right verbal skills, having great clinical skills. It all has to go together just like this.
Absolutely.
All right.
You
That was
know,
fun. I got to draw a little bit today. That's always fun.
well, it's
I need a
uh,
touch screen. I need a touch screen though.
something that I took away from my trip. So just got back from a European
Yeah.
vacation.
So this isn't just you trying to use your sexy voice. This is something different.
No, this is something that sexy voice. So as I've gotten older, easy and convenient
Mm.
have been so much more important in my life.
Yeah. Yeah. Easy and
I
convenient.
can do something, and I think that that's something that maybe got amplified during the pandemic.
Mm.
Um, but I think it's true of a lot of people. They want easy and convenient. And you want to, I'm going to urge my clients to sort of, actually, I already did, to look in their practices. How can they make things easier and more convenient for their patients?
Mm-hmm.
And the trust factor in that is that by looking to make things easier and convenient,
Mm-hmm.
you are exhibiting an empathy which will engender some kind of trust down the road as well.
How do you do that? How do you do that? How do you be, if you're wired, like think of that DC personality type, right? If you're wired analytically, how do you do that?
So you have to tell them. So you have to tell them what you're doing and why you're doing it, and it's for their benefit. You can't do something and not say why it's being done,
There you go.
right?
Yep.
So don't assume that people know why you're doing what you're doing.
Mm-hmm.
Um, I used to joke, as a matter of fact, I went, we traveled with another dentist. Um, and we were talking about the fact that probably the single biggest practice building or boosting thing we've had in both of us had in practice was the ability to give a painless injection.
Mm-hmm.
Now, I taught the course in local anesthesia when I was on faculty at Columbia. I taught it for 30 years. And I learned that you can't teach touch. Sorry, we either have a good touch or you don't have a good touch.
Yeah.
And it's not part of the admission requirements for dental school.
Mm.
So there are people that don't have good touch.
They're heavy handed.
Yeah.
Yeah.
If when you give somebody an injection and they don't feel it, it's pretty impressive.
It's awesome. From a patient experience, I tell you, it's awesome. Yeah. Well, I didn't even know you did anything. That's what you're wanting to hear.
Have you given it? Yes. So the reason I said tell them what you're doing.
Yeah.
So I used, and I hardly used topical anesthetic.
Mm.
I use distraction and pressure.
Mm-hmm.
And there's the gate theory of pain is physiology behind this, but I'm going to shake your lip.
Yeah. That's what my father-in-law does. Yeah. He did the whole thing.
I'm going to shake your lip. And I used to, it's not to cover up my Parkinson's.
Yeah.
I'm going to shake your lip. And it just makes a huge difference.
Yeah.
Little
things like that make a big difference. They
you
stack.
don't tell them, or
Yeah.
if you tell them afterwards, say, listen, how is that injection? That
Yeah.
was the best injection I ever had.
Didn't even know you did it. Yeah.
You know why? I distracted you.
Yeah.
And I will do everything that I can to minimize any discomfort you're going to have in this office.
Yeah.
Once you say that to them, that will build trust. But if you didn't say anything,
Just moving on.
you didn't
Yep.
capitalize on what you were really doing.
Yeah. You just reminded me of another great verbal skill system. Implication questions. You imply something when you ask them. The most universal one is, are you going to eat that? Right? Are you going to eat that? You're implying something when I say that. Hey, if you're not going to, I'd like to have that. But you can, all right, we're going to be doing oral cancer evaluation today. I'm going to be checking. Has anybody ever done this for you before? No. You imply, okay, credibility just increased. So there are things that you can do like that, where you can just ask the right question at the right timing, where it intersects, and you're building rapport, you're building credibility, you're building trust. My very first mentor, Walter Haley, said, believability plus likability equals trust, BLT. Believability plus likability equals trust. So the likability factor is rapport building. It's the DISC system. It's customer service. It's being interested, not interesting. It's emotional intelligence. It's EQ. The believability part is what you're talking about too. Every single experience they have building up to it is creating this atmosphere of, I believe you. I hear what you're saying. I believe. In other words, I'm going to trust you because I believe what you're saying. And they don't know how good of a dentist you are until they actually have dentistry. Think about all of the experiences, from referral website to phone call to sitting in your waiting room, not a, it's a reception area, not a waiting room. All these things that add up to a place where, up to where they decide, I trust you enough to let you touch me in that way, touch my mouth, and potentially a fearful experience for them in the past is preventing that too. You don't even know what you're overcoming. So all of those experiences create the believability factor to say, oh, you must be a really good dentist. Another simple one is, making the mistake of saying, so what brings you in today? Like you're talking about doing the research ahead of time. That research says you should walk in and say, hey, Mike, it's nice to meet you. I understand, Ricky Bobby referred you to us. That's so great. We really love him. I'm so glad he recommended us to you. And I know you talked to Michelle on the phone. She told me that you're having an issue on the upper right side. I want to hear more about that. But that you also work down here at the office building over here. That's so great. You're so close. I always wonder what you guys did in there. And you get in a conversation like that. It's subtle, but it's super effective in building trust. And what you're doing is saying, I already know this about you, but tell me more. I'm so interested. And it's a natural, it comes from Carnegie. It's a Carnegieism, right? Just show that interest, be interested in them. So yeah, love that stuff.
You said something very interesting. And I don't think dentists think about it enough. And that is, we're working in a very private, sensitive part of the body.
Mm-hmm. Mm-hmm. Oh, it's intimate.
I think that it's a natural tendency that we have as dentists to sort of take that for granted.
It's normal for you. Yeah.
And especially with new patients,
a stranger danger.
Asking permission.
That's right. That's so good. Right? Permission statement. Yeah.
Asking permission. What does that do to trust?
Yeah.
This person's not going to do something to me unless they ask my permission.
Friendly.
Maybe I can trust this person.
Yeah. It's definitely a trust factor. The permission statement's huge. I think to evaluate this for you, what you can start looking at is case acceptance tracker. I think that's something that we mentioned earlier. Make sure you're tracking your case acceptance. And the other thing that Dr. Ted Morgan would say, I can hear him in the back of my mind right now, the emotional exam. When you're doing an emotional exam and you're getting to know them, finding their why, what they want and why they want it, when they reveal that to you, it sends you a signal. They're trusting me. Everything they share with me that's personal and intimate is building that trust factor, which now is going to allow me to invade that intimate place of their mouth. I'm one, when you're a stranger to me, I have a pretty big personal bubble. I'm a handshake, not a hugger when I don't know you. Now, once I've spent time with you, now I'm touch, I'm hug, I'm more intimate that way, So to meet someone for the first time, to be laying down in a vulnerable position, opening, not knowing what they're doing, and just hoping and praying that there's no pain involved and that they're doing the right thing. My son is just going through, we just did 10 veneers. He's in provisionals right now. And he's down in LA at school. I have a client down there and I referred him over, and it's just timing happened to be that he's down there and not here for it. And there's a lot of, texting going on between me and the dentist, and like, okay, so tell me what it's going to be like, minimal prep, all these sorts of things that we're talking about. There's a huge amount of trust. Well, the provisional, while he's here on 12 and 13, broke. Well, he's here. He's not in LA. So now he's got to go to home dentists who did not do those, right? And so I already sent some pictures over and everything. And you know it was really, really cool. She goes, wow, this looks really good. This turned out really good. And she's great, great dentist. That's why we go to her. So it's just a lot of confirmation that what trust factor we put into someone that's far away and all of that with your son, just your baby, no matter how old he is, all of that came into play. So there's also things that happen after treatment that help confirm that trust. That then propels you to make more referrals, to talk about it even more, from emotional exam, permission statement, building credibility, all of that rapport building through treatment, even on the other side, that can make you feel like, okay, we're in the right spot.
So interesting. So I started to do veneers early. I mean, I was doing composite veneers before porcelain veneers came into being.
Yeah.
We did porcelain veneers. And I've eventually developed a system where I did all my cases Monday, Thursday.
Yeah. They had the delivery the same week.
Same week.
Yeah.
Because I never found a really good, reliable way of temporizing these.
Yeah. I know, right?
And if it were me, I don't want to go through a weekend.
Yeah.
I want to Monday.
Yep.
Say it meant that I had to. I mean, at one point I had my own lab, so the lab did it. But when I didn't, I reserved the technician.
Yeah. When you scheduled the preps.
Right. And what we did, again, we told the patient why we're doing
what to expect. Yeah, exactly. Yeah. Yeah.
It cost me more money.
Mm-hmm.
But it was because I don't want somebody to have to go through a weekend and have to worry about something, their front tooth popping off.
Yeah. 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 It's amazing how all the factors, all the things you can do or not do, there's also things that you're not doing to build trust, right? That play a role in this. And they're all little things. It's all stacking. It's all these, and you could do 9 things amazing in a row, and one thing can completely derail that. Trust curve could be going, and it's like you got to start over sometimes. So
whoever said don't sweat the small stuff wasn't a good businessman. Sweat the small stuff.
Yeah, I mean, that's what makes the biggest difference in the end. That's the culmination of all your hard work. You have to have, whether it's habit stacking, system stacking, customer service, all of it has to play a role in this. People aren't going to do big things with you when they don't trust you. Period.
Nope.
Absolutely agree.
And trust is becoming a diminishing commodity. So people don't trust today.
Yeah.
So I think it becomes even more important.
Sure.
Because it'll also just make you stand out.
Yeah, totally agree. I mean, that's where you create the raving fans who are out there talking about you, sending people in.
Right. So if you do that really well, you don't need to spend a lot of money on marketing.
Yeah. That would be nice, right? That's what we're trying to accomplish. Oh my goodness. Totally agree. All right. So if you're hearing objections, they're not going to come across as, hey, I don't trust you. They're going to come across as, yeah, I need to think about it. I need to get a second opinion. That's a sign or a symptom that you may want to look back at the history of events in that appointment and say, where did we go wrong? Where did we lose? Where did we break that trust factor? And if you're going to use that curve analogy, where did we break them? And you need to have team meetings. You need to have time with your team to talk about it. Your case acceptance tracker will show you, hey, this person, this large case did not say yes. Look at all these little cases saying yes. No big deal. But once we get in the large cases, for some reason, they're not saying yes. What is it in our appointment timeline where it's breaking down? Let's go work on that. That sound fair? Okay. Awesome. Anything else you want to add to it today?
So I think, I don't know, have you seen lots of your clients wanting to get rid of insurance?
Mm-hmm. More than ever, wanting to go out of network with insurance freedom.
And here's I think something that people don't think about, because when you go to when a patient
That's
goes
right.
to a dentist because they're accepting their plan,
Hmm.
there's often this, well, I don't need to trust them.
Yeah.
I'm going
Yep.
because it's
I
convenient
totally
and
get it. Yeah.
less expensive.
Mm-hmm.
If you don't invest the time to build trust, then when you go ahead and say, I'm
Yep.
no longer going to accept this PPO because it's not allowing me to do the kind of dentistry that I'd like to do, that you deserve, no trust, they're gone.
That's right. I came to you because of that. The analogy I used is in the movies where you see, these two people dating and they don't know it, but we know it, that this person over here just married him for the money. They're just married him for the money. And in that analogy, they married you for the money, meaning they came to you because you were in network. And all of a sudden they get in there and they find out and then eventually they fall in love with them, but then they realize there is no money. Oh, there is no money. What are they going to do? And the movie's, hanging there, and they're, oh, please love them for the right reasons, and they either leave or stay, depending on the movie, I suppose. So the same thing here. If your patients are just marrying you for the money because you're in network, right, and then you change the money situation, now you're going to find out if you were able to build rapport and trust and have customer service and credibility and have all those things in there. Because if they're just going to somebody else as a network, they don't see the value in what it is you're providing. You have to be full of it. And by it, I mean customer service, all the intangible factors, your human skills, your ability to communicate. It's all got to be top notch. You can't just be the same average Joe and be out of network. That's for sure.
So I remember, I think I had a patient who said, you know, I have this insurance plan, and if I go to another dentist, I can get my teeth cleaned for nothing. But I won't trust anybody but you to do any work. So I said, I remember saying, there's a problem with that thinking. And that is, you're assuming that they're going to know when you need work, or they're going to know early enough
Mm,
so that the work that you need isn't that big.
mm,
And that's the real value of coming here, to having your teeth taken care of by the hygienist.
yeah.
Then I can see you.
Mm-hmm.
Unless you want to have your teeth clean and come and be examined by me,
Mm-hmm. Mm-hmm.
that's fine.
Mm-hmm. Yeah.
Oh,
That's a good point. I like that. The reason you come here is because of my expertise, the factor that you believe me in what I'm doing. Well, if I can't see it, you're gone, 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 gone. And all of a sudden you show up with a big problem. There's a good chance I could have prevented that because of what you believe in me. So I need to see you twice a year for exams. That's a good point. I like that. Yeah.
yeah,
Okay. All right. Awesome. This has been fun.
it always is.
Always is. All right. Well, I will see you in September. All right, guys. Thanks for joining us. By the way, so allstardentalacademy.com/events. If you want to learn how to build trust with patients through case acceptance process, practice perfect systems as well. You can work on some things there. I'm sure you guys have all your event. You have an event coming up, or did it just pass?
No, we have an event coming up in Newport Beach in October.
Okay. Yeah. So we're in Portland, Maine in October 19th and 20th, 2-day event. It's basically all trust building. It's all case acceptance training, verbal skill training, phone skills, all the way through to stopping the cancellation. So what are you guys doing in Newport?
That's a good question.
You're training, right? You're
I
training.
haven't, I haven't thought about anything for 2
You
weeks.
just got back. I know. This is your first day
I
back,
just
huh?
got back. What am I doing in October? Maybe I should think about that.
It's
I
there.
know it's printed, it's on the schedule.
It's there.
I know I'm giving a workshop. Um, yeah, I'll figure it out.
It's all important. All growth is important, right? Listen, the practice doesn't grow if the individuals aren't growing, right? There's no way the entity that is built by individuals can grow if the individuals aren't worth putting effort into their own personal growth. So personal growth, having a growth mindset, that's what's key right now for any business right now. You've got to be on top of it before things get hard. Might seem easy right now. We come out of almost a generation of, oh, we're flooded with business. It's not always going to be the case. We watch this housing market. We follow what happens with the housing market, and it has some signs to it that says, okay, what's going on? The housing market has really slowed down as you watch inflation. And we could sit around like we did in 2008, 2009 and go, we're medical. It doesn't apply to us. And then all of a sudden 2010, 11 comes along, you go, wait a second, this hurts. So we need to be prepared for that. We need to be fully trained so that we make every opportunity worth it. Don't take any chances. All right.
Yep.
Agreed. All right.
Cool.
We'll see you guys next month. Have a good one. Bye.